The new book I'm reading, it's called The Heart Healers, which is about the misfits, mavericks, and rebels who created the greatest medical breakthrough of our lives. Is by James S. Forrester, who's a medical doctor. And I was just reading the first, just skimming through the first chapter, and basically what he talks about at the beginning is he tries to explain to you about the heart. He explains that you have to think about how much work your heart is doing. That it's like basically without it, obviously you'd be dead because there would be nothing to pump the blood throughout your body, which gives oxygen to your muscles, which is extremely important. So he said the effort of the heart is approximately 90,000 strong push-ups every day, with no stop or rest for like good behavior. Like obviously someone's heart will stop. That's like not good behavior. Like obviously your heart is like having a problem, right? But with a good working heart that works throughout the thing, and try thinking about that for 80 years, just nonstop. And you think about that, we can't even do that same pace, clenching and unclenching our fists for like an hour. And the size of this is so small. It's so small for a big job that it does. It's about in between the size of a baseball and a softball. It's extremely muscular, which explains how it's able to do all of this motions. It's constantly doing that. So it's constantly working out itself. And being specific, the left side. So if you think about the heart, I actually do have a picture here. If you think about the heart, the right side where the blood comes in, the deoxygenated blood comes in, it then goes into the pulmonary arteries that goes to the lungs to refresh itself. Then goes back to the left side to get pumped to the rest of the body through the aorta. And as you can tell here, you see it's much more thicker than here, because the left ventricle, which is probably the strongest pump in the body, that's the one clenching force that is used to pump the blood to the rest of the body, which is it's making it go for a lot. So yeah. And basically how these like clenching and unclenching motions are happening through the pump is electric pulses that are being sent about 60 times a minute, or once per second, and this is like resting. It's causing the heart to like do this pumping motion, which every time the electric pulse happens that is given to the heart, it does a little like squeezing motion, this clenching motion, which kind of powerfully jets out the blood to wherever its designated place is. For example, right aorta, it's not as strong as the right ventricle, obviously, because it's only pumping from one chamber to the next. But then the right ventricle then pumps all the way to the lungs, so it needs some force there, a little bit stronger. Then goes to the left atrium, again not as strong as the left ventricle, but because it's just going from chamber to chamber. And the left ventricle, the strongest, has probably the strongest clenching motion, because it has to jet out all the way to a complex network of the body, and then eventually goes back to restart. And actually about that, it takes about 60 heartbeats to complete one cycle at rest. So, assuming that each electrical pulse is a beat, that's about it takes about 1 minute I'm just assuming here, could be wrong, but about 1 minute for the blood to be completed through one cycle at rest. If you were to look inside yourself without opening yourself up, because then you would show obviously you're gonna bleed out, but then also thinking about the blood color, if you're on one side of your body where the blood is deoxygenated, it'll be dark blue. But obviously, if you cut yourself on it, well, don't cut yourself. But like if you get a cut on both sides, you'll notice that they'll both be red, maybe one darker than the other. Well, and why is it not blue? It's not blue because once it's outside your body, it's exposed to oxygen, and maybe not as exposed to oxygen as the bright red side, but that's why it's still slightly darker on one side than the other. But it's still exposed to oxygen, thus it's not dark blue anymore. It's sort of brightening up. And one of the amazing qualities about a heart is that, let's say you're in the woods and you're confronted by a bear. The heart, like how fast your heart beats, whatever you're thinking of, flight or fight, if you're going to fight or you're going to have to run away from this bear, the heart will definitely help you in that because it can triple or quadruple its normal beating pace per minute for like sprints to like run away or to like maybe get like enough action to maybe punch it in the snout or something like that. So yeah, that's basically it about the heart, but I did get enough time to read a little bit about the first issue, kind of like in the last book, the one with the worm in her head and other true stories about infectious diseases. I did a couple of book reviews. You should check that out. Almost every chapter there's like one different case. So I'm assuming that's kind of how this book works. But yeah, so he starts talking about the case of someone named Greta Adams, who has like, we don't actually necessarily know, but it starts out saying she lives in LA. You know, the area that she lives in has beautifully foggy in the morning. And during those times, she loves to jog. But then very recently, whenever she jogs, she gets like a chest pain and like, she gets like a, sort of like a chest pain, right? In the sternum, and then like all of a sudden when she stops running and she like starts walking a little bit, she rapidly becomes like, when she rests, it just all of a sudden the pain just stops. Now she's been thinking, there's a bunch of hypotheses why she was thinking, okay, why am I having this issue? Well, one of them, she feels like, okay, maybe it's just psychological. I'm having stress about my child's bully. Or maybe it could be the salty, moist air of the fog from where she lives in LA. Or could it be a heart issue about the death of her father, who died unexpectedly at age 57 from a heart issue. I mean, obviously this book is about the heart, so we already know which one it is, but I don't know, it kind of leaves you in a bit of suspense about that. So obviously she goes to the author of this book, who's a doctor at the time, and obviously she's like happy to see the doctor that she's going to be worked on, but then soon after, when they're about to talk about her symptoms and her issue, she's obviously like extremely nervous. And I think one of the main traits I feel like a doctor should have is what Dr. Forrester did do, was that his technique to talk calmly to his patient is not even like, first of all, don't go straight to the point about what it is, but like discuss about life. So he was discussing how he used to coach Little League, and he used to be like a swimmer. And then her patient soon talked about, oh yeah, her son is doing Little League, and her husband is a surfer, right? Which slowly then helps them to lead to where is the cause of the pain or discomfort that's happening. For example, he slowly dives into her jogging in the morning, and then eventually through this connecting point, he eventually goes, once the patient is comfortable, he talks about the elephant in the room, which is, well, the issue that she has with her heart, or hypothesis, yeah. So, the chest pain diagnosis, what he believes is coronary artery disease, or CAD for short. And right now, without knowing anything, just with saying, okay, she has issue with chest pain, it's like less than 1% chance. But then the thing is, Greta herself has the thing to kind of know if someone has coronary artery disease is how many principles of angina, which is the pain caused by coronary artery disease, has 3 principles, which is pain from the sternum, pain in the sternum, that is specifically caused by exercise, and rapidly like relaxed, and the pain is going away by rest. And currently she has all 3. And if you have all 3, most people have like a 90% chance of having coronary artery disease if they have all 3 of these symptoms of angina. With the shot up chances of this and also the father's condition, and assuming everything, it's about 50% chance right now. And so eventually she does work with her, and he's like, okay, let's go discuss about the heart. Let's go examine your heart. And so he goes to this room, and so he's about to like examine it, but that's actually where I had to stop off. But yeah, I haven't, to be honest, ever since I was little, the heart was something I was really interested in. And so that's why I kind of like slowed down me reading The Woman with the Worm in Her Head. I mean, infectious diseases, that was probably the second thing I got interested in after reading a book about Ebola. But I don't know, I just kind of wanted to go back to like the heart. But yeah, I did really enjoy this book. And that pretty much ends where we are at. But yeah.
So there's 2 questions I'd like to know. The first one, you say when she visited the doctor at first, the doctor did not go straight to the questions. He went through talking about his life, on her life, and tried to find something in common. What do you think? Why he did that?
Kind of to comfort her, because like in the book they were kind of describing how she was smiling in the beginning, and as soon as they sat down, she's about to start a conversation, her smile just completely faded away. Her hands are like uncomfortably on her lap.
Okay.
Because she kind of wants it to get over with, but she's very uncomfortable. And I guess as a doctor, you kind of have to see this, like, you kind of have to see this, and have to kind of relate and try to talk about this to your patient. So I guess he's just like, just being more cautious about it. Yeah.
So, and then you say that he's going through a process in order to get to this conclusion.
I mean, this is what I'm noticing. I'm noticing this process. I kind of like did it myself. I didn't actually say that, but he did say that, of course, he didn't go straight to the point. He said that I first talked about this, eventually I went to the jog, then eventually I talked about her issue about the chest.
So what you learn, he needs to know. Are you saying that you need to know about the environment of the person before to go to a conclusion?
I mean, yeah. So like, if I have like someone I'm about to, like, if I was a doctor and I had someone who I was about to check up on, I would first like read their issue, read like where do they live and stuff, and like, for example, if they're from like somewhere like Kansas or someplace I've never been, I'd probably like research it and like, okay, what are common things, or what's like the area or the climate, or like, wherever they are. Like, for example, if someone lives in Lake Tahoe area, I would know that maybe they like something about skiing or something, or maybe they like the cold weather, I don't know. Or if they live in like, let's say San Francisco, they kind of are used to the busy city or something.
Okay, so he asked question also about her family, is that right?
Sort
you
of,
say that
yeah.
her father died at 57?
Yeah.
So he was trying to find if there is some issue in the family about the heart. That's what you meant?
Yeah, I feel like doctors really ask that question a lot. I'm not necessarily sure if it has anything to do with it. Maybe it's like a passed down disease. I think, because not all the diseases are like passed down. Like you can pass down, but
I
I feel
mean
like
genetic.
yeah, not genetic. Yeah,
Okay.
not all of them are genetic, but
Mm.
I feel like most of them are because that's a very common question. Like for example, a parasitic disease, like something that's caused by a parasite. That's not necessarily genetic. I could maybe, if I lived in some remote island and got like the parasitic disease and moved to America, had kids, my kids might not necessarily have the same parasitic disease, right? So yeah.
So the other thing I wanted to ask is, when I meant going through a process, I mean, you say you went through 3 points before to do the conclusion.
Oh, about
There could be
India?
many things.
Yeah, so he was talking about, he said there was about 3 points
Okay.
that you had to think about. 3 principles of angio, which is the pain caused by ACD, so CAD. So
which
first
is
of all,
coronary disease.
yeah,
Okay.
coronary artery disease. So basically, the pain has to like start from the sternum or be some part of the sternum, right? And it also has to be caused by exercise or like increased heart rate. And then the pain should stop almost immediately once your heart is sort of like going slowly back to its normal like thing. I mean, like after, let's say you like sprinted 100 meters, your heart won't immediately go back to its normal position or normal speed of beats, right?
Yeah.
It'll like slowly go back down. That's why you have to like, if you're like an athlete, most of the time you have to warm down, maybe walk off, so your heart is like slowly getting used to you walking and then like just standing still, right?
Okay, so you say that the 3 things I want to make sure. So you say when they do an effort, it hurts on the sternum. You say.
Right.
Then the second thing you say, when you stop, it stop hurting right away. That's what you
sort of, not necessarily right away. I mean, like once your heart
go back to speed, go back to normal speed. What about the third one?
The third has to be the rapidly stop one. That's the third one. It has to be through exercise. Is the second one.
Oh. So
or not necessarily exercise, but like increased heart rate.
So the third one is what again? Then the last one is what?
It would rapidly stop. So basically, what I'm guessing is that you can't just have like the first and third one. It has to be first and second, or first, second, third.
So
I feel like
the third one is when you stop.
This is literally all he said. He just said it was pain in the sternum.
Yeah. I'm trying to understand.
Rapidly, really.
So the third one, he say, if your heart stops to beat rapidly, too fast, that's what.
That it stopped hurting.
Then that would be a sign of a coronary disease. That's what you said.
Yeah, but again, the pain has to be from the sternum, and your heart has to increase beats, and that's when it's hurting. And then it rapidly, all of a sudden, it's when the heart slows down, so does your pain. Your pain slowly fades away.
Okay. So So my last question is, what was in all what you write so far? What is the one you prefer the most? The thing you didn't know, and that you learned and that was interesting to you.
The doctor's technique about how he talked to his patient. I mean, it's kind of like, I would kind of think about that. I mean, it would kind of make sense, but I feel like most of my favorite ones I've been thinking about is like, how does a doctor deal with the patient who has this like issue?
Oh, okay. So he's trying to find common point and try to, that you did not know before and you learn it. Okay, nice. Okay. Thank you.